Good afternoon and welcome to the COVID-19 update on Channels Television. I'm Millicent Wonka. First, some of the highlights. Government sets a July 29 deadline on its next line of action, reevaluates the state of facilities available in over 20,000 secondary schools in the country. Former NLC Vice President advocates out-of-season exam for WAEC students, kicks against reopening of schools. And United Kingdom government signs deals for 90 million doses of promising coronavirus vaccines. Coronavirus cases around the world has risen to over 14.5 million, according to the Johns Hopkins Coronavirus Resource Center. The numbers in the African continent is 627,304 confirmed cases. The Nigeria Center for Disease Control, NCDC, announced that Nigeria's cases now stand at 36,663, while 15,105 patients have recovered. The death toll is put at 789. The center announced 556 new cases of the virus recorded in 17 states and the FCT. The new cases were recorded in Edo, 104, Lagos, 97, the FCT, 70, Benue with 66, Oyo 61, Kaduna 38, Plateau 28, Osun 19, Akwa Ibom 14, Rivers 13, Katsina 13, Ondo 13 as well. 6 cases in Ogun, 5 in Kano, 4 in Nasarawa, 2 in Gombe, 2 in Ekiti, and 1 case in Borno State. The top 5 states in Nigeria with confirmed cases are Lagos, the FCT, Oyo, Edo, and Rivers State, even though, as at today, the states with more people on admission include Lagos, that's the epicenter, with 11,298, the FCT with 2,105 cases, Oyo State has 1,031 patients on admission. Ondo State, there's 761, while Delta, which is number 4, is managing 756 cases, and Edo, 701 patients in its treatment centers. The NCDC says that a multi-sectoral National Emergency Operations Center has been activated at level 3. It continues to coordinate the national response activities. Now, against the surge of panic over fears of final year students of Nigerian secondary schools missing out on this year's West African School Certificate examination, it appears the federal government may be reconsidering its stand by setting a 29 July deadline for a template in reevaluating the state of facilities available in over 20,000 secondary schools in the country. According to the Minister of State for Education, Mr. Emeka Nwajuba, who spoke in an interview via telephone, he explains that the July 29 reevaluation deadline is to examine the number of schools that have met the federal government's guidelines for the WAEC examination. He believes the date would provide a clearer view on the next line of action regarding the examination.
WAEC has released a guideline. While we're still negotiating with the WAEC with a view to getting some extension to the date, while we're still doing that, it is important that Nigerians know that the current timetable is from the 4th of August through to the 5th of September. We expect and we're believing that we can get an extension to that. However, in the interim, our planning to take these exams should begin to prepare. We are not schools. There's no resumption of schools yet, but that the facilities of school can be used if they comply with the guidelines we set out. And we've asked everybody to come back to us before the 29th of July to say whether they are in readiness, meeting the guidelines we've given for you to be able to use those facilities. That's what we did, and it's remained consistent last month. We've given them a template to report as to their readiness, the venues to be ready. So we just want to know who is ready and who is not ready. We only own 104 schools. The rest, about 19,000, are owned by state governments and private schools, private institutions. So we want to know, we want to find out from them how ready they are ahead of those dates. We've never said nobody. If we are not ready, if the places are not prepared and are not safe for our children, we will not allow them to be used so that we don't put our children at risk. The issue is getting the places ready. Nobody is going to put Nigerian children at risk. If it means moving on to the next academic session, we will. But the important thing is that they will be alive to do those exams. And that's what the ministry has insisted. It's the same thing we've been saying all along. Just get the places ready. If they are ready, we'll use them. If they are not ready, we can't use them. And that is why we said that they should report back with the templates, because inspectors will check them out. Everything is, we're monitoring and evaluating what the processes are. We've given a template for the reporting, and that's why we said we're giving a deadline.
Still on the issue of resumption of students during the pandemic, the former Vice President of the Nigeria Labour Congress, Mr. Issa Remo, is calling for negotiations on an out-of-season date for the writing of the West African Examination Council and senior secondary school examinations until the COVID-19 curve drops. He was addressing reporters in Kaduna, where he says the Nigerian government should request WAEC to conduct the exams when the environment is right out of the regular May, June, November, December seasons, adding that an urgent need for a systematic awareness about the prevention of the virus among pupils, teachers and parents before government should reconsider reopening schools.
As they say, hurry, they tear trouser. But hurry with COVID-19, we know only tear trouser. It takes lives. I think we need to be systematic about usage of face mask. We have to be systematic about social distancing. We have to be systematic about washing of hands regularly and usage of sanitizers. And we must be systematic about the way we are going to reopen the schools. I think it's important that if the figures are not coming down with infection rates, Nigeria should constructively engage with WAEC to make a case for out-of-season examinations. And I think we have the highest number of pupils in West Africa. Not only that, I even expect Nigeria to offer leadership to impress on WAEC, the council as a whole, to be able to postpone the exams. Because as I've said, only students who are alive can do exams.
Let's go to Emo State, where the state's COVID-19 task force chairman, Professor Maurice Iwu, joins us via Skype from Owerri. Thank you for joining us, Professor. As one of pharmacognosy, what's your take on these students staying home, waiting for when the virus curve has, been reasonably flattened to write their exams?
Yeah, we are watching. Thank you. We are watching the national trend. Here in Emo State, what we have done is to have a meeting with the health, within the health and the education ministries, and also the other stakeholders. The discussion is ongoing. The whole idea, as I've been mentioned, is if we can get the students to do social distancing, to wear their face masks, and also to maintain basic hygiene. But these are young people. Rebellion is part and parcel of the culture of that age. So we are also very mindful of that. We have painted a couple of scenarios, and then we are trying to see when we can escalate that into full action. But whatever happens, the most important factor is the health and the safety of our children. We don't want to rush them into examination hall if we feel the place is not safe. And I'm glad that the federal government is monitoring. And if an independent assessment is made and they find that we're not ready, then we're just not ready. But we're doing all we can to make that happen. On Friday, the task force, decentralized operations of the task force, the Ministry of Health, Education is taking the lead in that aspect. The Ministry of Health are doing their things. So what we have done now that the virus is here with us, we have to learn how to cope with it. And that is what we are doing. The Ministry of Health will take care of all the health-related matters. Education Ministry will do that. Even get children from the point A to point B where they will take the exam poses its own challenges. Not everybody has a car. If they are going to use public transport, how are you going to guarantee that the transport that they are using is safe? And other people who are going to be in the public transport are going to wear their face masks and maintain the basic social distancing. So the problem is huge. It looks simple from its onset, but when you look at the details of what it takes to implement those guidelines, it's really enormous. So we are taking a holistic approach. Right now, we are not taking any decision either way. Even if the federal government say yes, they want the students to take the exams, and we find that we are not ready, we will not take the exams.
All right.
Even
so
if
essentially,
the WAEC says the student must take the exam, so we will not take the exam. So we are trying to domesticate those guidelines and see whether we are ready or not.
We'd like to thank you, Professor Maurice Sewu, Professor of Pharmacognosy. Thank you for joining us at this time. Let's go over to our Abuja studios, where Dr. Kashmir Ifeanyi, a medical molecular microbiologist and also a public health advocate, he joins us on the program. And this is as we talk about COVID-19 and transmission. Thank you for joining us on the program. All right. Here's hoping you can hear me. I'd like to begin with the news we got over the weekend. The Foreign Affairs Minister becoming one of the latest high-profile individuals in the country to contract the virus. And this is apart from a number of other senior politicians who have tested positive for COVID-19. At what point, perhaps, would you say that this virus was transmitted? Between where and what? As we're trying to understand what this virus is, where can we say that transmission occurred from one particular person to another, with all of the call for the non-pharmaceutical measures, since there's no vaccine? How did that happen?
Thank you, Millicent. Now, what has happened, and the story making the rounds about the Honorable Minister of Foreign Affairs gives us a matter to be worried about. Why are we going to be worried about? We are worried because it calls for urgent deployment of local response to our local situations. Now, the truth about this disease is that you wouldn't aptly say that this is when an infection has occurred, because it will take its progression to establish as an infection. When one is exposed to a sufficient effective dose of the virus, this is what will happen. Your immune system, your antibodies will respond, and when they respond and they are overwhelmed, your cells will take in the virus, and the virus can now commence replication within the cells. However, a second line of response triggered by the T cells, what we call killer cells, will be deployed to see if it can kill all the infecting virus in the cells. It's only when this is overwhelmed, of course, that infection becomes fully established. If you follow the story of the minister, he said this is his fourth test, that when he had an itchy throat, he called for another test. That itchy throat is what a whole lot of Nigerians would neglect and will carry on and will tell you they are well and they are sound. And then they will therefore pose risk to the community, particularly when they are guards about non-pharmaceutical intervention, NPIS, is not fully operationalized, as it's the case in most parts of the country. It's only in the Abuja city. If you do a 30-kilometer out of the Abuja city, you will find significant non-compliance. People live as if nothing is at stake, as if there's no disease, as if there's no pandemic. So for the minister, you know that all this while, the minister has been involved in the management of Nigerians returning from various parts of the world, particularly even from countries where the disease has ravaged more of the population than is the case in Nigeria. You find out that countries that have had history of flu, they are better informed in managing flu-based pandemic like we have now, because they have flu year in, year out. And I can tell you based on studies that the SARS-CoV-2 is significantly related with the SARS-1 that was discovered sometime in the late 90s, early 2000s. And so because of that relatedness, we found out that people from that area have what one would consider a residual immunity, because if they have immunity to SARS-1, it will apply sufficiently to SARS-2. So for our Honorable Minister, one can rightly say that his engagement in the management of these people that are coming from different parts of the world, where we have different variant of the SARS-CoV-2 pandemic virus ravaging their population, may have put him at a risk.
May have, but we also know, I must quickly cut in, because we also know that they're supposed to have tested, negative before being brought back into the country based on the new guidelines. But we need to go on a break now. I do apologize, and we'll come and take your final thoughts on this issue. Stay with us. And we've been talking to our guest in Abuja, Dr. Kashmir Ifeanyi, a medical molecular microbiologist. And this is to ask a final question to you. And if you can just tell us, perhaps in a minute, based on what you've said about the virus transmission and how novel this virus is, not knowing, and the importance of the non-pharmaceutical measures, would you say that perhaps it is time to open international flights?
Certainly no. You see, you talked about the people coming back being tested. Now, you find out that in some parts of the world, they are using the rapid antibody testing. And so it calls to question the sensitivity of the antibody testing panels that are already deployed in some parts of the world where these people are coming from. It calls really into question. And I can tell you rightly so, what we have not done in Nigeria is that we have not determined exposure risk profile for the various kind of work we do, and our risk profile for the other exposures and endeavor. So that has not been done. And honestly, because our compliance rate with non-pharmaceutical interventions in the country is still very low, if not even non-existent, it is not time enough for us to begin to receive foreign flights. I can tell you that the recent spikes we noticed in Nigeria cannot be far disassociated with the mass return of people from other parts of the climate, because as a scientist, I am concerned about the testing that those persons go through before they board the aircraft, because we are aware that some of these countries are using rapid test kits
rather than the PCR, which we're using,
as the PCR or molecular-based methodologies recommended by the
We'd like to thank you. Thank you so much, Dr. Kashmir Ifeanyi, medical molecular microbiologist. Thank you for joining us on the program.
It's a pleasure to be here.
Now, over in Niger State, our correspondent Emperor Simon brings us this update on the State's Emergency Operations Center.
Based on available statistics to us from the Emergency Operations Center, Niger State currently has a total of 155 confirmed positive cases of COVID-19. Now, out of that figure, 112 have been discharged, 7 deaths have been recorded, and 7 persons are said to be on admission at the Quarantine and Treatment Center in Minna. 20 of the affected persons, representing 15%, are said to be doctors or medical health workers. In terms of gender spread, 78% of the affected cases are male, while 22% are female. We also see that in the area of local government spread, Chanchaga local government, which is situated in the heart of the state capital, Minna, has the highest figure of 71 affected persons, while Suleja currently has 19 confirmed cases. Bida local government area has 17 confirmed cases, while Kontagora has 14 confirmed cases. That's the update from Niger State. Emperor Simon for COVID-19 update.
Many thanks, Emperor. As many countries around the world race for a permanent solution to the pandemic, the UK government has signed deals for 90 million doses of promising coronavirus vaccines that are being developed. Now, the vaccines are being researched by an alliance between the pharmaceutical companies BioNTech and Pfizer, as well as the firm Valneva. This new deal is on top of 100 million doses of the Oxford University vaccine being developed by AstraZeneca. However, it is still uncertain which of the experimental vaccines may work. The number of confirmed infections worldwide is just now under 14.5 million, while the death toll has risen above 600,000.
The UK has signed deals with Pfizer, BioNTech, Valneva for COVID-19 vaccines to secure 90 million doses of two possible vaccines. The Business Ministry says 30 million doses of the experimental vaccine will be from BioNTech and Pfizer, and a deal in principle for 60 million doses of the Valneva vaccine, with an option of 40 million more doses if it was proven to be safe, effective and suitable.
It evokes our immune system, and they get trained to very quickly respond with what we call the antibodies or immune cells. And now the body is ready, it has memory. And once the real virus knocks on the door to infect us, we respond fast and intercept it from becoming an expanding viral population that threatens our life.
In France, masks are now also compulsory in indoor spaces such as shops, restaurants and banks. They were already required on public transport, and people can be fined €135 for failing to comply. Similarly, Hong Kong is stepping up its measures against the virus after a record new number of cases were recorded on Sunday. Authorities have announced a series of new measures, including the mandatory wearing of face masks in indoor public spaces. Despite this, residents are worried about the new spike in cases. And after a half-year closure, some cinemas in low-risk areas across China have reopened as the COVID-19 pandemic keeps a low rate in the country over the past few months. Cinemas in the low-risk areas have been allowed to resume operations starting from July 20th, following significant improvement.
Our website, channelstv.com, has the latest news. All you need to do is log on, access the news in health, politics, business, sports, Africa, and around the world. You can find most of the stories, as you can see there, the top stories coming in Nigeria and across the world. channelstv.com. That's the program. Thank you for watching. I'm Millicent Walker. Stay safe.